The number of reported COVID-19 cases and deaths increased throughout the area again this week. A grim milestone was reached and then passed in North Attleboro when 8 additional deaths were reported over the last 7 days. I spoke to the town's public health director and nurse, Anne Marie Fleming, outside of Town Hall about trending on Thursday.
North Attleboro is holding its own. We are at 208 cases as of this morning, which is less than 1% of the population, which is what they were expecting an average. So that's a good thing. And I have seen the cases actually slow down over the last couple of days. They are slowing down. Deaths, unfortunately, are still occurring. We're getting a few. We're at 21 today. It's sad. It really is. It's what we were fearful of. It's those who are most vulnerable, that have underlying diseases that they just can't seem to shake off when they do get the COVID infection. They're just not shaking it off the way that, say, you and I, without underlying diseases, can shake it off.
What's interesting about each governor setting his or her own restrictions is when they start to lift those restrictions. We're right on the Rhode Island border here. Rhode Island loosening restrictions. How does that impact a town like North Attleboro?
Well, we are a border state, and we've always had a pretty fluid border. I joke that we don't have, any barriers between the states. We joke about that sometimes with mosquitoes, nothing stops people from entering. So we've always had Rhode Island cars or people, within our town, and vice versa. There are plenty of people that will go to the malls in Rhode Island as well. What may be frustrating or different is there's differences in approach. But I think right now, even if Rhode Island is loosening up some of their restrictions, they're still mandating the mask wearing, which is most important, because we need to be able to keep that barrier between us to help reduce the spread of disease. So I'm hoping that there'll be no impacting. The retailers might find a few more people that will be going, but I expect that we may see some people from Massachusetts also going into Rhode Island. So it'll be back and forth.
Governor Baker, this Wednesday, May 6th, issued an order that people are required to wear masks. How does that get enforced in a town like North Attleboro?
Well, I like to hope it doesn't have to be enforced, that people will comply with that. It is something that certainly the Board of Health can enforce it. Certainly the police can enforce it. They've established fines with it. Really, we want people to do that on their own. The reason for it is good science. If you're wearing the mask, you're not exposing others, especially the most vulnerable. We don't know what someone's immune system is as we go by. And really, if people would look at it that you're protecting others, never mind yourself, it's only a little inconvenience, when people are out and about. If they're 6 feet away from people, they don't have to keep the mask across themselves, but they should have it available, have a bandana or a mask around their neck. So if they're gonna go by someone, they can just pop it up so that they'll be protecting other people.
In your position as the public health nurse, Board of Health, when you see a front page picture in the Sun Chronicle of youngsters or teens playing basketball up at the North Attleboro Middle School, what do you tell people like that?
I know. It's a challenge. Those who are the very young, it's more difficult because they don't feel that they're going to get sick. Why be worried? What they don't realize is that they could get infected and then bring it home to someone. They may not get sick, but they may get someone else sick that can't muster the resources to be able to handle the disease. We do want them to comply. They have bandanas, they have trendy masks with skulls and crossbones and things. It's an inconvenience, it's a challenge, but they really should be doing it for others.